Hi. Have you been living with chronic neck pain, chronic shoulder pain, or tension headaches for over 6 months? And have you seen at least 3 other doctors without getting any relief? If so, you're probably thinking, I'm scared, my pain's never gonna go away. First, I'd like you to listen to what New Jersey's premier chronic neck and shoulder pain doctor has to say. Please meet Dr. Joe.
Hey there! If you're looking for permanent relief, I am so glad you found this video, so you can learn how you can finally fix your stubborn pain like our patient Leo did.
I found the Barefoot Rehab on Instagram, and I decided to reach out to them, and thank God I was able to see them, because they really were able to save my life practically. I was just miserable, depressed, not being able to do my regular work, coaching and teaching, a phys ed teacher as well. So back to 100% and very pleased.
I'm Dr. Joe McGraby, non-surgical neck and shoulder chronic pain specialist with Barefoot Rehab in Denville, New Jersey. We have been helping patients who have had pain for more than 6 months and seen at least 3 doctors or therapists without relief since 2010. In this video, we're trying to save you from going down the same route that Diana went before finding us.
So before Barefoot Rehab, I saw upwards of 30-something specialists. One day we decided to sit down and do the math, and I think we've honestly spent upwards of 20 grand at least, like out of pocket, seeing these specialists.
Yes, you heard that right. We specialize in fixing people's pain when nothing else works. You see, it's not your fault that no one has ever told you about the most common cause of chronic pain that 9 out of 10 of our patients have never heard of. It's kind of like glue in your muscles. It's called adhesion. If you've ever eaten a really chewy piece of steak, you know what that white stuff is. No amount of chiropractic adjustments, physical therapy, or the most intense massage will remove this gunk. Cheryl tried all of these, but was disappointed until she found us.
I've gone to chiropractors, massage therapy, doctors, cortisone shots, you name it, I've tried it, and nothing's worked. So far, after 6 visits, I've been feeling much better.
Maybe you've had a cortisone shot or already had surgery, and still you're wondering, will I have to live with this pain for the rest of my life? Our answer is a very confident, no you won't. How do you know if you have adhesion? We already discussed the first qualifiers. 6 months of pain, you've seen 3 or more doctors or therapists without relief. Next, we're going to use 5 neck tests to see if you have adhesion in your neck and your upper back. Number 1, the chin tuck test. With the chin tuck test, our goal is 25 degrees. We're just going to tuck the chin in. And she gets stuck right there. She has a range of 15 degrees. Number 2, the chin to chest test. So we're going to tuck in. From here, the head comes off the block, and we bring your chin down to your chest. We stop right there, so about 2 fingers, but let's get a measurement on that. 50 degrees. Number 3, the upper back flexion test. From here, you're going to bring your forehead down to the floor. This is the upper back flexion test. Let the head drop if you can, and she's kind of stuck up into here. So we're going to remeasure this again, and this is 67 degrees, and the goal is to be as close to 90 with this one. So this one's pretty restricted as well. Number 4 and 5 is neck rotation. 1, looking to the left, and 2, looking to the right. And let's turn your head to the left, please. Stop right there. Good. 56-62. Stop right there. 58-64. These tests are key. Some of our patients have seen chiropractors or physical therapists for 20 or 30 visits with 0% relief, and they're scared to trust another doctor. Go ahead and find yourself a wall and try the first 2 tests right now. You won't be able to measure range, but if you have symptoms, that's a really good sign that you have adhesion. For the chin tuck test, tuck your chin in as you slide the back of your head up the wall. Do you feel anything? For the chin to chest test, tuck your chin in again, but this time let your forehead come down towards the floor. Feel anything? If you felt anything, that's good news, because you likely have adhesion in your neck. These tests are so valuable that we test you before and after every single treatment, so you know you're on your way to permanent relief. And we have a 5-visit rule, where we expect to get you some percentage of permanent relief in 5 visits or less. We've had way too many patients see chiropractors or physical therapists for 20, 40, or 60 treatments with 0% relief that we came up with this rule to protect you from flushing your money down the toilet. In this way, we want to reduce any skepticism you have when you walk in the door, because Anthony had it too before he canceled his surgery.
I was somewhat skeptical, but the moment I walked in, I felt this really positive energy of good people, everyone that truly loved what they did.
Now, if you're restricted, you're probably thinking, I'll just stretch it. One of the first pieces of advice we give our new patients is to stop stretching. The reason why is because once you've had pain for so long, no amount of stretching will be able to tear the gluey adhesion from your neck, and wrenching on your inflamed discs and facets will only make the pain worse. Often our patients get 10% permanent relief before we even touch them after heeding this advice. Then we tell them to respect the sit, slide, lean rule. We're gonna sit at the edge of the chair. We're gonna slide our butt all the way to the back of the chair, and we lean back with both our feet flat on the ground. Next, stop burying your head with your cell phone in your lap. I know it's hard to fix, but every one of our patients is able to fix their posture by the time we discharge them because they learn to respect their neck. Our patients get another 10% for a total of 20% relief when they stop stretching and implement the sit, slide, lean. And then we finally start looking for adhesion. You can see that once a patient's tests get better, their permanent relief gets better too. And to make your test better, we have to remove the adhesion. Aren't you happy there's just one clinic in New Jersey certified to find and fix adhesion? Over the past few years, we've had patients fly in from Puerto Rico, the Dominican Republic, California, Washington, Massachusetts, Oregon, North Carolina, Virginia, Florida, and a couple patients from Texas too. Every one of the patients came to us because they haven't felt heard by their regular doctors and were angry for having wasted their time and money without any permanent relief.
She was tired of going from doctor to doctor without any answer or relief. She was frustrated, she was angry.
I wasn't heard, I wasn't listened to. I had to fight for them to even get me the correct diagnosis.
You deserve to be heard, felt, and listened to. If you're not used to getting hugged by 5 people in a doctor's office, let us know before you come in so we don't scare you away. Now you might be wondering, can everyone be fixed with adhesion removal? The answer is no. Sometimes we can't help people. We referred Kristen straight to a surgeon years before we ever helped her.
You know, we did all the testing and everything, and he sits me down and he goes, Kristen, he's like, I'm saying this in the most honest way possible. He goes, you need to see a shoulder surgeon. He's like, I believe there's something more than adhesion going on in your shoulder. He's like, I would love to help you, but I can't. So he said, go find a shoulder surgeon and let me know what happens.
We pride ourselves on being honest with someone when we can get them permanent relief. But please don't take my word for it. Please check out our over 65-star reviews on Facebook, 95-star reviews on Google, 71 video testimonials on YouTube. If you're ready to take the first step to finally getting some permanent relief, just click the link below to see a compilation of our testimonial videos. There you'll get an opportunity to schedule a free 30-minute phone call with one of our compassionate patient advocates to see if you qualify for permanent pain relief in one of the country's premier pain clinics. So if you haven't already, click on the link in the video to schedule a call and take the first steps to finally getting permanent pain relief in as little as 1 to 2 weeks. Look, we know you've been let down before. I'm asking you to muster up the courage to try one more pain clinic to finally get your life back. Our staff bleeds and breathes seeing you heal and be happy again.
So we really love helping people here. So please, please come in. You won't regret it. And we love you.